Have you ever woken up more exhausted than when you went to bed? Your neck stiff, your lower back aching, and your head feeling heavy. Maybe you chalk it up to just getting older. But what if I told you it might not be your age at all? What if your usual sleeping position is slowly increasing your risk of heart problems, nerve issues, and even a stroke, without you realizing it? It's not a scare tactic. This insight comes directly from decades of medical experience, and by the end of this video, you'll know the 5 most harmful sleeping positions to avoid, and the one golden position that can protect your heart, spine, and brain while you sleep. Why sleeping position matters. More after 60. Dr. Chen, a respected rehabilitation and pain specialist, has treated thousands of older adults with chronic pain and neurological issues. His findings show that nearly 70% of these cases are linked to poor sleeping posture. After 60, the way we sleep affects 3 essential repair processes in the body. The first is brain detoxification. When we reach deep sleep, our brain's cleanup system activates, flushing away waste products, including beta-amyloid protein, a substance strongly linked to Alzheimer's disease. A poor sleeping position can block you from reaching deep sleep, meaning the brain never gets its nightly cleanup. The second process is the resetting of our body's stress system. At night, we should shift into a state of rest and repair, lowering blood pressure and heart rate. But if your airway is blocked or your spine is compressed, your body may remain in a stress mode all night, keeping your heart working harder and your blood pressure higher than it should be. The third process is the recovery of the spine and surrounding muscles. During the day, your spine carries your body's weight and is under constant pressure. Nighttime is when the discs rehydrate and the muscles relax, if your posture allows it. A poor sleeping position forces certain muscles to work overtime while you sleep, leading to stiffness, numbness, and gradual joint damage over time. 5. Sleeping on your stomach. Many people find this comforting, but it forces your neck into an unnatural twist for hours, straining the joints and compressing nerves. It also flattens your chest against the bed, making breathing shallower, and it puts uneven pressure on your jaw, which over time can cause jaw joint issues. 4th, flat on your back without support. While it may seem healthy, this position is risky for people who snore or have sleep apnea. Gravity pulls the tongue and soft tissues back toward the airway, making it harder to breathe and lowering oxygen levels. If you do sleep on your back, place a pillow under your knees to reduce pressure on the lower spine and keep it properly aligned. 3. Left side sleeping for certain conditions. This may be fine for healthy individuals, but it can be uncomfortable for those with heart failure, as it places extra pressure on the heart. For people with acid reflux, left side sleeping makes it easier for stomach acid to flow back into the esophagus, leading to nighttime heartburn or coughing. 2. Using an overly high pillow. A tall pillow forces your head forward all night, straining neck muscles, compressing discs, and possibly reducing blood flow to the brain. Especially dangerous if your arteries are already narrowed. 1. Sleeping flat with legs fully extended. And the most damaging position is sleeping flat with your legs fully extended, especially on your back. This posture tightens a deep core muscle called the iliopsis, which pulls the lower spine into an unhealthy arch and concentrates pressure on the small joints of the spine. Over time, this can worsen back pain and cause serious disc problems. The golden sleeping position. So what's the best way to sleep? Dr. Chen recommends the modified right side sleeping position. Here's how it works. First, lie down on your right side. This helps reduce pressure on the heart and lowers the risk of acid reflux. Next, choose a pillow of medium height, just enough so your head, neck, and upper spine stay in a straight, natural line. Then, slightly bend your knees and hips, releasing tension from the lower back. Place a small pillow between your knees to keep your hips and spine aligned and prevent twisting during the night. If your shoulders or arms feel uncomfortable, hug another pillow to your chest for support. If you prefer to lie on your back occasionally, use the supported back position by placing a pillow under your knees. This will keep your spine in a more natural curve and protect the lower back from strain. Beyond posture, 3 habits can greatly improve sleep quality. The first is avoiding alcohol before bed. While a drink may make you sleepy at first, alcohol disrupts deep, restorative sleep in the second half of the night, leaving you feeling tired the next day. The second is managing water intake. Staying hydrated is important, but try to drink most of your fluids earlier in the day. Reducing water intake after 8 p.m. and avoiding drinks in the last hour before bed can help prevent nighttime bathroom trips that interrupt your rest. The third is creating a sleep-friendly environment. Keep your bedroom cool, ideally between 68 and 72 degrees Fahrenheit. Make it as dark as possible to encourage melatonin production, and remove sources of blue light such as phones and tablets. If noise is an issue, use earplugs or gentle white noise to block disturbances. To summarize, avoid these harmful sleeping positions: lying on your stomach, lying flat without knee support, sleeping on your left side. If you have certain health issues, using a pillow that's too high, and lying with your legs fully extended on your back. Instead, aim for the modified right side sleeping position or the supported back position as an alternative. Good health is built from small, consistent choices, night after night. Changing the way you sleep can take time, especially if you've been in the same habit for decades. But if you give it a few weeks, your body will adapt, and you may wake up feeling more rested than you have in years. Tonight, I encourage you to take 2 minutes before bed to get into the golden position. Try it for 1 to 2 weeks and notice the difference in your energy, mood, and comfort. If you're ready to commit, type in the comments, "I'll start tonight." Your words may inspire someone else to protect their health too. Share this video with your loved ones, because better sleep is one of the greatest gifts we can give each other. This is Elder Wisdom, wishing you a peaceful night and a healthier tomorrow.